morning. I'm Dr. G. Prasad Rao, a senior psychiatrist from Asha Hospital, Hyderabad. Always wonderful to see you through this Manasarovar YouTube channel. Today, I thought I would bring to you one of the commonest abnormal emotions, jealousy. Jealousy is, very simply said, feeling uncomfortable, unhappy with what you don't have or what others have. So jealousy is commonly used that instead of you focusing on yourself, you focus on what others have. Mostly it is related to possession, but it can also be related to emotions of attachment. For example, an excessive attachment towards the spouse, towards the child, towards the family member leads the individual not to allow the person to react with others. Very commonly, a wife or a husband, for that matter, anyone can develop jealousy because of this over possessiveness, would not allow the partner to freely talk to the other members of other sex or sometimes even members of the same sex. For example, a very highly over possessive person, what they normally do is they focus on how the spouse is talking to the others, whether he is smiling. Even it can be a normal smile, but they don't want that. They think that smile itself communicating an attachment, or smiling and talking is an attachment, or spending a little longer time is an attachment. So in a way, they are upset that this partner, and it can happen with the child as well, that the child should not be interacting with neighbors, neighbor children, neighbor family members. So in a way, because of their excessive love and over possessiveness, the member who is suffering from jealousy actually puts the family members in a pressure. More often than not, it is called morbid jealousy. Morbid jealousy means abnormal jealousy. Yes, it is an abnormal jealousy. Jealousy, a little bit of possessiveness is always useful because then you will be more careful in your love and attachment. And no guesses, women are generally more possessive than men in terms of sexual differentiation of the jealousy. So jealousy, normal jealousy to some extent is a good thing, but the boundary of normalcy to abnormalcy is whenever the individual starts controlling the partner or a family member, asking them not to talk, watching them. And today's world, they are watching the WhatsApp messages, they are watching the Facebook, they are watching the Instagrams, they watch the emails, they would like to look for contents and what is the communication contents. So in a way, these boundaries are crossed whenever the checking becomes as a kind of an obsession. An obsession is a repeated behavior which would impair the individual, and not only that, for example, calling to the office and finding out what they are doing, finding out whether if they don't lift the phone immediately, they will say, look, you are talking to somebody, or trying to identify that there is a perfume on the body, that means you have gone closer to a woman, or men, of course. So here, the person who is having jealousy would become extremely sensitive and over possessive and cause problems to the partners or a family member. Ladies and gentlemen, everything in control and not over is normal. And normal jealousy can happen, but abnormal jealousy should not happen. I will come and discuss the disorders where morbid jealousy can be there in my future Manasarovar YouTube channels. If you are sensitive today of what jealousy, normal jealousy is, I would be more than satisfied. And if you can identify what is abnormal and help the friends and relatives in making them aware and identify. That's my purpose of doing this YouTube is served. I hope to see you very soon in my Manasarovar YouTube channels. Bye bye for now. Yours, Dr. G. Prasad Rao. I am Dr. G. Prasad Rao, a senior psychiatrist from Hyderabad,